Okay, so Sharmi suffered an anterior dislocation, and as much as it sucks, we have a great wrapping technique to help her. And what we're doing is we're essentially pulling her in the opposite direction that shoulder goes when it goes into an anterior glide. So we see it wrapping forward and pulling that shoulder forward because the shoulder, when it's gliding anteriorly, wants to go into external rotation and into extension. So we're pulling her in the opposite direction. So that's why it's important that we start here and start wrapping this way to avoid pulling her backwards into the motion that would further exacerbate that anterior dislocation. Once again, you keep pulling it around, making sure to pull it tightly over the shoulder, and that's where you get the most stretch with the bandage.
This is a long ace wrap.
And that's why the size of the ace wrap is important. And it depends on your athlete or your patient.
You can just tuck it in.
And sometimes if you have tape available, you can tape it, or if you don't and you need something, you can tuck it in just like that. And perfect.
Give it a little 360. There we go.
There we go. Looks wonderful. That's for an anterior dislocation. And then here we have for a posterior dislocation. So you see the direction of the pull is going, ironically, in the posterior direction, because what we're trying to do is avoid the motion that would further exacerbate that posterior dislocation, which is the internal rotation and flexion. So we have that nice wrapping technique. So it kind of looks the same as the anterior dislocation, except with the exception that your starting point on the forearm, on the arm will differ. So again, you can see we tucked it in because we don't have tape available, but he's nice and pulled into external rotation and away from any motion that would exacerbate that posterior dislocation. Looks wonderful.